Okay, well, it looks like it's kind of slowed down on people joining on the Zoom. So if for some reason I don't see someone pop in and they message and say, "Hey, tell her to let me in," y'all let me know. Okay. All right. We're going to go ahead and get started because I know it's late. We'll get this kicked off and I'll try to see if anybody pops in. Good job. Well, that probably was an easy one, but just make sure to go through and look back on all the different cranial nerves and how you would actually assess them. I will make sure, like in the questions, that I'll actually give you not just the cranial nerve number, but also the name to help as well. And remember, there's like three of them, like 3, 4, and 6, that actually work together in different ways for movement of the eye. So make sure that you take a look at those to keep those clear, but just review over those and like kind of like we walked through the other day and assessing those, make sure you know how to properly assess each cranial nerve.
I have a question on that
Oh,
because
hang on. Hang on just a second. It's probably going to the next question. Okay, go ahead.
uh, I was listening to the recording from class, and I think are we using the six cardinal gates on 4 through 6?
So usually 4 and 6 are the ones that is like the cardinal gazes together. And the reason it is because on the like on cranial nerve 4, it's like the down and inward movement of the eye. And then like 6 is actually the lateral movement of the eye.
Okay.
Sorry if it might have said something confusing way back when I made those. And then usually like on cranial nerve 3 is usually going to be more of the pupil response when you do pearla. And there is extraocular movement that occurs with that as well as eyelid, but I'll make sure if I do, oh, let her in. If I do have one of those happen to be on the test, I'll try to make sure that it's very clear if I do utilize that, okay?
Next.
Okay, when we were talking about falls, make sure you know some of the risk factors for falls for like your older adults. The Schmid or Morse are scales that we utilize. Um, be familiar with the things that like we look at when assessing, you know, the risk for falls, like, you know, medications or history of falls. We also talked about like if your patient scores that they are at risk for falls. I think it's on the back of the SMID maybe. There's like examples of things, and we talked about it in class, like things that you would implement for that patient if you were worried about them being high risk for falls. The FRAC scale, we anybody know what that one's for?
That is risk of fracture.
Yes, that is correct. And then, of course, we have the bone density test, but that's totally different. I just kind of threw that in there. But that is what is the bone density test for?
Bone mineral, like the size of the bone, basically.
Yes, and we usually, you know, get that. The older we get, we'll do a screening test. And who is at highest risk for fractures and
Women,
osteoporosis?
women over 50.
Yes, and remember our white, small white frame female.
Or Asian.
Somebody mute. I don't know who has that, but I can't because I can't see it, but make sure you're muted. Okay, and that one was obviously a good one for y'all. Y'all all remembered atrial fibrillation, which I'm excited about. You'll learn more about that next semester. But also take a look at the other risk factors for stroke. There was numerous ones so make sure you take a look at those. That was in the neuro chapter. Okay, so in the neuro chapter, there was also other diagnostic tests like for balance and cerebellar function that we went over, like how you'd actually assess those. So make sure that you know what it would be you would be asking the patient to do. And then, like with the Romberg, when would we know that that was a positive test? What would the patient do with their eyes closed?
They would have imbalance basically.
Yes, they'd start swaying and start to fall. So make sure though you go back and look at the examples of the rapid alternating movements and heel to shin. And of course, we talked about gait as well. Okay, so go back and take a look at these. There's a section where there's one like the strongylosis, like it says, with putting something familiar. There's the graphesia where you're drawing something and it needs to be clear where they would understand it. We had talked about the kinesthesia where you're moving a body part or joint and getting them to tell us, which direction that it's moving. And then there's 2-point discrimination, and this is where it's 2 points in the same area being touched at the same time. And there's some more of these examples as well, other diagnostic tests we went over. So make sure you know how you would assess those on a patient.
You can see me. That's in my house.
Okay, and so what are the other three? What are they?
Osteoarthritis.
Yes, very good. So make sure you take a look at the osteoarthritis as well. Okay, so what do we want them to do?
You want them to basically have weight bearing exercises, increase their calcium and vitamin D levels.
Yes, and so that says decrease. We actually want to increase it. Then also you said weight bearing exercise. Be familiar with what some examples of weight bearing exercise is. And like I think another thing that it might have mentioned is like, smoking and alcohol cessation is something that they also recommend in that health promotion section. Okay, and so that's a big part of. I want to take a second and just kind of say a few things about the culture chapter because I feel like sometimes it can seem like it's a little hard whenever we're asking questions. But number one is remember we have to always make sure of our own feelings. Um, I want to guide you back to because sometimes it's hard to know what kind of questions is she going to ask. So in your book, you don't have to grab it now, but you can go back in your book at the end of the chapter. There are questions, and I think if you haven't already looked at those, look at those because those are giving you examples of scenarios of different situations that a nurse may be in that's related to culture. And a lot of times, if you look at these, usually, as I've mentioned before, like, looking at the answer choices and seeing, reading the question and then saying, okay, is this anything that's going to hurt them? We need to respect some of their beliefs, even though it might not be something that we understand. Respecting them. You always want to, reflect on yourself, on your own beliefs. And if you have any issues, then maybe if you don't feel like you can give the care, then and maybe get someone that can. And then also asking them. So when you're looking at the answers, just always look at if any of those are options, like about reflecting on themselves, respecting it, looking at it. If it's not hurting anything, then we can let them do it because sometimes they can do what they want. Maybe like I think an example might have been in the book was something about like acupuncture. That's fine if they're doing that and ask them if it helps. And then we may have to also treat them with some medications as well. So it doesn't always mean that they have to stop whatever it is that they're doing if it's some other alternative care that they believe in. So if you hadn't already, take a look at those questions. Those are like some good examples of ways that I would ask a question. I'll give you a scenario. But those main things, and another thing to make sure that you don't do when it comes to culture is we talked about stereotyping and kind of umbrellaing everybody under if they fall in a certain culture, it doesn't always mean that they believe the same. So be careful with that as well. Okay, so what should that be? Does anybody know the one that it should be? Best
Motors.
mode. Yes, very good. Motor response. And what exactly is the Glasgow Coma Scale assessing?
The level of
Anybody?
consciousness.
Yes, yes, yes. Very good. I won't make you score those, but just be familiar with those, the three categories that we're assessing and what it is that we're assessing for. This come out of the musculoskeletal in the med-surg book. There's an area that goes over the different kinds of descriptions of the different types of pains, and we went over those in class. So review back over those. So if you have a question where a patient is describing their type of pain that they're having, you would be able to recognize where it's coming from. Okay, so drink plenty of fluids afterwards, and what do we do before it?
You into the bladder.
Yes, good job.
Is that's for the same for the bone density one as well, correct?
Yes.
Into the bladder.
Yeah, because they'll assess in the pelvic area.
Okay.
Okay, so make sure, like in that question there, it's asking about peripheral pain. And so you want to make sure that, whenever, so peripheral means that's going to be on the extremities, and all of the others are more in the central part of the body. And so that's going to be more whenever you're having to get more rigorous and cause more pain. Because typically they'll, might do it just on the, cuticle and it won't be cause as much pain. But then if they go to, needing, they're not responsive, then they're going to try some of these others that don't feel so good. So they may start with peripheral, but they may end up doing, and the most common one we do a lot of times is going to be more of the sternal rub. And sometimes you will see them, squeeze the trapezius, but usually the sternal rub is one of the most common ones that we see clinically. And that's on page, like 331. So take a look at that chart. You forgot about that. We kind of talked briefly about that. So take a look at that in your health assessment book. Okay, so obviously y'all picked up on I like my six P's, and I love them. I love the way that you're able to kind of remember them, but make sure what is it that this is assessing? What is the neurovascular assessment doing? What are we looking for?
You're looking for injury.
Injury, yes. Uh-huh. And then the big thing is tissue injury because of anybody know? If we don't have good perfusion, remember it's cutting off the blood flow. When is one of the most common? You said injury, any orthopedic surgeries, and you always want to do that assessment below the injury because we're wanting to make sure that nothing from the injury is impeding any blood flow, to the area below it. So make sure you not only understand these six P's, but I'll know what they're for. What are we assessing? And then also know what are some of the negative findings that we would find. We had talked about those as well. Oh, I misspelled posturing. That's supposed to be posturing. Sorry. Okay, so this actually, I think in y'all's textbook may be on the example is on the actual Glasgow Coma scale that shows you from different injuries on the brain, which like the positioning and posturing that the patient will do. And so I always tell people there's deceberate and there's a decorticate. And so I always just try to remember to help me differentiate between the two is like core is going to be them pulling their hands into their core. Like you'll see them go internally and like lay their hands by their chest. And so I think of core. And so I can always remember that one that they're extended, where with deceberate, they're going to be, they're going to be flexed with, with decorticate and extended with decerebate. So that's how I remember them. But they are part of the neurological assessment and can mean, something very bad if you witness your patient in these positions. So just know the difference in the way that those patients would be in what position they would be in, depending on if they're decorticate or decerebrate. Okay, so it looks like most of y'all know the differences. So just make sure you're familiar with what aphasia is, period, which is the not of inability to communicate. And there is the two different type, which the receptive is going to be the opposite, where they can't receive the information. Expressive is they're not able to give that. So good job. Okay, and so make sure you go back and take a look at those, which they're, if you'll think about like the cultural desire, I just have to start usually at the top of it, like in my mind, and think like cultural desire is, the motivation. They have that desire to want to learn about culture. Cultural awareness is going to be them. The cultural awareness is, remember, them, like they are going to look at their own beliefs. And then the desire, I already did that one. I said cultural. I had to put cultural desire twice. I'm like, what in the world? And then on the cultural skill, that is where they're implementing it into their care and they're able to communicate, effectively and utilizing any like assistance with language or language barriers and assistive devices and things like that for those patients. So take a look. In chapter 5, there is that chart that'll review back over those definitions. So we talked about malnutrition being something that we commonly see in the older adults. So actually, it's bad dentition is because the in the question it just said which of the following is not. There's one of those words, one of those tricky words right there. So there's more of examples. So make sure you take a look at some of those risk factors because that is something commonly we see in the clinical setting, and so you need to be aware of those that would be at risk for it. Okay, and so does anybody know, there's one that is expected to be different. Anybody know what that is?
Their temperature?
Yes, that's correct. But everything else is supposed to be the
Temperature.
same. Now we do know
Is their
that
temperature.
yes, very good. Um, we know that there's things that a patient can have that can make them have like either a high or a low, but on blood pressure or heart rate. But on the norm, the expected is for them to be normally the same, except for temperature. I don't think I didn't know that if I said this or not, but we were talking about the risk for malnutrition in the older adult, but also make sure you look at falls. I don't know if I said that earlier when we were talking about the fall score, but we also discussed some of the things that put the older adult at risk for fall. So make sure y'all take a look at that. I don't think I have this as one of the questions on here. Okay. So in the older adult chapter, overall period is different. It just kind of goes through some of the expected findings that you may see in an older adult. And this example was just in skin. And so know some of the examples from, of course, on the skin. The liver spots are just like the brown spots, and those seborrheic keratosis, that's going to be like more of the wartier raised looking lesions. And of course, I made this one easy when I put tag up there in the question, but just make sure you look at not just the skin, but also all the different areas in the body. A lot of them we've already mentioned as we went along in the semester, but review back over those in all the different body systems. What would be some of the expected normal variations of a older adult? Good job. So know the other deformities, spinal deformities that you may see, where the location is of that deformity and the direction that it would be curving. Okay, so in the bone chapter in the MedSurg book, there was some examples of laboratory tests, and this is where this can be found at. We had talked about though the parathyroid is what produces the serum calcium, and so of course if it's not working right, then yes, it can alter it. There were some more examples of like it went over how reasons why you would have an elevated serum calcium, like with bone fracture, and tumors, immobility. There's also a diagnostic test we look at for like muscle injuries. It talks about how calcium and phosphorus are inversely proportionate. So go take a look at that little section there and be familiar with some of those. Oh, Lord, I was typing fast earlier, so that's supposed to be having a AN and electromyography. Okay, good job. So in that same chapter, there are numerous diagnostic tests. Of course, I want y'all being familiar with what they are, but y'all know my routine. I like to know what do I need to know before it. And like this one is saying, not to wear lotions. There's some more education that can go along with this. With all of those little diagnostic tests, also making sure you tell me, what are some of the post things? Does it need to be iced? Does it need to be wrapped? Does it need to be elevated? Does it need to be kept straight? What are the and things? We also talked about the complications to teach your patient whenever they have those. What is it that they need to be looking for? So be familiar with those. And a lot of them are the same, but review back over those. Okay, and I just picked out speech, but there's other disabilities. I think there's even actually like a chart that kind of goes over in the disabilities and chronic chapter about how you would communicate with people with different types of disabilities and what would be the best method. So take a look at some of those. Yes, so we want to make sure that they're a person. So we're going to say the patient with diabetes, And in this chapter, this is another one kind of like culture that can be, a little bit difficult. Like when it comes to like, well, what is she going to ask about? And of course, there are the different types of disabilities. Like I said, the communication with them. Also think about why are we having so many more chronic illnesses now? What defines a chronic illness? And then I'm going to ask maybe about like what are some of the barriers to these people and the challenges that they face? For example, they may have um, multiple, medications or doctors, so much that they can't keep up with everything that they're doing. Some may not have transportation to the different appointments and things. So it's a little bit more broad. This chapter is to me. There won't be quite as many, questions probably out of this chapter, but those things that I just kind of threw out at you will be things to be expected to make sure that you, take a look at in that chapter. Um, I'm trying to stop my share, but I can't. Okay, so I'm trying to think. Let me think. Let me take a look and see if there's anything else that stands out. Let's see. Another thing that we talked about with chronic illness was, like what was our major goal we were trying to accomplish? We try to accomplish with them. We know that they're not a lot of times going to get healed or get better, but we want them, their ADLs is very important. We're wanting them to get back as close to functioning as possible. Let me see if there's anything else I might have left off. Um, in the musculoskeletal chapter, like in the assessment book, there were things like checking for strengths. How would we do that? What would be some examples of that? In the neuro chapter, there were things like how to assess for the reflexes and how we might would grade those. That's something that we did. We did talk about some examples of some deformities you might see in like rheumatoid arthritis versus osteoarthritis. I think that's um, I think that is I think that's a really good start, you guys. Hopefully by now, though, I know it's Tuesday night, but hopefully y'all have been this helped kind of kick off to see whether or not you need to hit any areas a little bit more um, or not. Do you have any questions? Okay, well, I've already kept you 40 minutes, so thank you guys for your time, and I will see you Thursday morning on Halloween. Bye, you guys.